So then, you see the frontal? This is the frontal, right? You look at, right in the center, there's a process that sticks up, a thin process that sticks up. You notice that? That's the cribriform plate. And the openings, there should be tiny openings on each side, but ours is plastic, so you just see it. The depression on each side of that should have openings. That's called the olfactory foramen. A foramen is an opening right there, okay? Foramen, F-O-R-A-M-E-N, foramen, olfactory foramen. So this structure that sticks up, you trace that. You pretend that it's like a little metal that's inserted all the way, and you trace that all the way down. You see the perpendicular plate then in the nose. You see that? You see the perpendicular plate in the center. So you go look at the nose, that's the plate that goes straight down from that, the cribriform plate. That's what you call the perpendicular plate. That's actually the last bone of the cranium, ethmoid bone. So what are the bones of the cranium? Frontal, parietal, temporal, occipital, ethmoid, and sphenoid. Do you see where the ethmoid is now? From the cribriform plate, which contains the olfactory foramen, right, all the way down to the center. Look at the nose, this nose, there's a metal, there's a plate right in the center, right? That's called the perpendicular plate. That is part of the ethmoid bone. Okay? Okay? So that's all cranium. Everything else is facial bone. Now let's look at the sphenoid bone, by the way. The sphenoid is these two butterflies, right? And now you flip your skull this way. You flip it this way. You see the hard palate? You see the hard palate? You know the hard palate right there? Go to the side of that one. You see two plates that sticks out, the pterygoid process, the lateral and the medial pterygoid process, which is this one, lateral and medial. That's part of the sphenoid bone. You see it?
This here?
Very good. Yep. The whole thing, right? This one, lateral process, medial pterygoid. And there's your perpendicular plate. That's the ethmoid bone. So these two is sphenoid, and that one is ethmoid. Okay? So we see both ethmoid and sphenoid with this view. There's the ethmoid. This is the perpendicular plate. This is the ethmoid. And this is sphenoid. This is the lateral pterygoid process of the sphenoid. And this is the medial pterygoid process of the sphenoid. Show them. Yes, very good. This is your ethmoid bone. This is the perpendicular plate, right? And this is a sphenoid bone. This is the lateral pterygoid process and the medial pterygoid process.
What are these things?
Those are the styloid processes. Yeah. And then this humpy one right here, that's the mastoid.
She studied it.
Okay, you got that?
I've taken a version of
Okay.
AMP before.
Good. Okay, now we're going to go into more detail, but now we're just getting to know them. Now we go to the facial bones. So I'm sure everyone knows the mandible.
Yes.
Okay? So the mandible, you notice there's so many different structures or markings that the book talks about. I'm just picking on what I want you to remember for me. You see your arm, you go like this, you go like that, right? Right? So this is the arm also. See, that's the arm. This is called the angle. Don't you have an angle? Your elbow angle. And this is your arm, right? So this is the arm, right? This is the arm. So if you remember, arm in A&P terms is called ramus. R-A-M-U-S. Ramus. Same as arm. Sometimes if I feel bad and I really want to help you, if you wrote arm, I still accept. I don't give full credit, I give partial. So this just remember, right? This is your arm, right? And there's your angle. So this is the angle of the mandible. This must be the arm. The arm is called the ramus. Okay? And you see there's two processes right here, right? A depression is always called a notch. So this is called the mandibular notch. A notch is always a depression. But you see these two processes? One is nice and rounded, not as pointy as the other one, right? The one that's nice and rounded is called the condyle. The one that's pointy is called a coronal process. You know, the crown has like tips, pointy tips. Not coronal. Coronoid process. Coronoid process. N-O-I-D. Coronoid process. So this is the mandibular condyle. C-O-N-D-Y-L-E. Condyle. And this is coronoid process. So can you tell me which of the two, would it be the condyle or the coronoid process that will articulate with the temporal bone?
The condyle.
The
Condyle.
condyle, right? Okay. I like to ask that, which of the two articulates with the temporal bone? It's the condyle, right? What type of articulation is that? Synarthrosis, amphiarthrosis, diarthrosis? Diarthrosis. It's fully movable. You know, if a joint is able to do any of those movements we talked about, flexion, extension, rotation, protraction, protrusion, all of that, then that means it's a diarthrosis. Okay? So, remember this movement, elevate, depress, okay? Okay, then you see the teeth. The teeth occupy a space, right? There was a, when you have your pulled, when your tooth gets pulled, there's a space, right? The space occupied by the tooth is called alveolus or alveoli. Okay? Next, you see the openings, the holes? A hole is called a foramen. Do you see the hole on each side? That's called the mental foramen. The chin is referred to as the mentum. So this is the mental foramen. That's what they look for when they give you injection to for anesthesia, right? They're trying to numb the mental nerve.
Mm-hmm.
So that supplies the mandibular area plus the nutrition to the teeth. So if you numb that, they can do dental procedures. And now flip. There's another foramen right there. You see the other foramen inside? And that's called the mandibular foramen. That will numb the mandibular nerve. They're all branches of the trigeminal nerve. So again, mental foramen, you know where it is? Mandibular foramen, you know where it is? Okay. So now it makes sense. If you've ever had any oral procedure, they go here like that for the anesthesia. If it's the front that they're going to work on, they go all the way there to the mandibular nerve. If it's the back that they're going to work on, okay? It's not just, it has to be, they know the exact, they don't just put it anywhere. They know where this one is, okay? So sometimes they pull your, what's this? Your this, or put the anesthesia there. Or they open your mouth, put the anesthesia inside there, okay? Okay, so that's that. Next, facial bone, okay? The next facial bone I want you to know, maxilla. Right? Facial bone also. Please memorize what's a facial bone and what's cranial bone. Sometimes I do circle which one does not belong. So I'll write frontal bone, sphenoid, maxilla, parietal, etc. And then you should circle the maxilla because everything else is cranial bone. Something like that. So the maxilla is referred to as the keystone bone. of the face, meaning keystone facial bone, because it actually articulates with all the other cranial bones. So it's keystone, like the main anchor. Okay, next, look, move to the side right here. You see now the zygomatic bone is like a little square. You see, right? So if you feel your cheek right here, it starts at the maxilla, and then zygomatic bone, and then temporal bone, right? So your whole cheekbone is a contribution between the temporal, the zygomatic, and the maxilla. So in the test, be sure you look at where the pointer is pointing, okay? Is it pointing to the zygomatic, to the temporal, or the maxilla? Be sure, okay? The next one, you see, look at the zygomatic, goes all the way up here, right? Here, this bone right here in your eye is called orbit. That's the orbit, right? What's this bone? I know you know it. What's this bone right here?
The nasal bone?
The nasal bone, right? Nasal bone. And then there's a tiny little bone there which I don't ask, the lacrimal bone. I don't ask the tiny little bone. But you must know the big bones, the nasal bone. Tell me if you have any question identifying the bones. I'm going to tell you nasal, maxillary bone, zygomatic bone, mandibular bone. Orbit, the orbit. Orbit. You got that? Okay, very good. Okay, lastly, sinuses. Sinuses. So sinuses are actually spaces within the bone. They're like cavities. And they serve to lighten your skull actually. Because your skull is heavy. If this was pure solid bone, it's going to be heavy to carry your head, right? Some people, they have big heads already, they say. Can you imagine if it was, it's very hard to carry. So that's why God made sure we have spaces in there. And the spaces or cavities are called sinuses. You ever had sinusitis? Right? Sometimes. And when you have sinusitis, where's the pain? All around here. Even here? Even here. Painful. The sinuses, you see it's around my nose. The sinuses are called paranasal sinuses. Why is it called paranasal? Because they surround the nose. Right here and inside. So where do you think I'll find sinuses? Here, right? Frontal bone. Where else? Here. Maxillary bone. I'm going to have sinuses there. That's why it's painful. And then inside there's still pain because look at, it's surrounding the nose, right? So ethmoid bone and sphenoid bone will have sinuses. So where do you find sinuses again? Frontal bone, maxilla,
maxillary,
your
sphenoid,
and
and
ethmoid. Which one does not belong?
the maxillary?
Maxilla, because maxilla is facial bone. Okay? What's the shape of your skull? What's this shape? It's a,
Flat bone?
very good, it's a flat bone. Very good. Okay? So, before we move further, there's going to be there's going to be different processes here that I want you to know. Oh, okay, let me talk about these things that stick out now. Do you know the mastoid process? Do you see? Yeah, that's the mastoid process of the temporal bone. So you feel the back of your ear, that's the mastoid process right there. Right? Do you know where the mastoid process is? You got that? Okay. This one contains also what you call air cells, and there's air. That's why that can be infected when you have middle ear problems or inner ear problems. You can have infection that goes all the way in, and that's called mastoid treat them with antibiotics. Right? The next process I want you to know, you see the one that sticks out? Like the stylus of a pen, right? Like a stylus. That's why it's called styloid process. Styloid process. Both these processes belong to the temporal bone. The mastoid process and the styloid process is temporal bone. Okay? So you must know that. And so then, if you look at between the styloid and the mastoid, you see there's an opening there? That is called the stylomastoid foramen. Stylomastoid foramen. Between the styloid and the mastoid process. You know these different openings, you're gonna master them. Okay? All these openings you see, you must memorize them, and it's not hard. Okay? Why are there openings? What's your guess? Why are there openings here?
Nerves.
Correct, for nerves and blood vessels, right? You see the brain sits here, and what comes out of the brain and the spinal cord are nerves.
Mm-hmm.
You saw some of the nerves when you were cutting the skin. They were like string, right? Where did they originate from? From the brain and the spinal cord. So if the brain sits here, nerves come out, they must come out through all these openings you see. Let's look at the biggest opening, which is the foramen magnum. Right? What comes out here is the spinal cord. So the foramen magnum is the boundary actually. Above the foramen magnum, it's still called brain. Below the foramen magnum, you call it now the spinal cord. You see this bump right here? You feel the bump. For bald guys, you see the bump in their head, right? That bump. You know why they're bumps? The bumps or protrusions? They're because muscles attach to them, right? This is the attachment for your trapezius. And so it helps, right? To move. So this is, what is this bone again?
Occipital protuberance.
Did you know it's called protuberance? It protrudes, right? Is it outside or inside? What is this, outside or inside? So it's called external occipital protuberance. Okay? It's outside, it's external. It's in the occipital bone, occipital. And it protrudes, protuberance. External occipital protuberance, or in short, EOP. And then you flip inside, you see that there's its counterpart inside. Do you see the counterpart inside? That's the IOP, internal occipital protuberance. Inside this protuberance is where the meninges, the membrane that covers your brain, that's where it anchors. Your brain needs to have a solid anchor, otherwise it will just be jarred every time you do whatever you want. So, EOP, you got the EOP? You got the IOP. The EOP is for attachment of your traps, right? The IOP is for attachment of the meninges that covers the brain. Okay? Okay, now, so now we look, I told you that most of the openings here is for the nerves. That's where they come out of. Okay? Let's just look at a few. The nerves are actually named or numbered from number 1 all the way to number 12. Number 1 to 12. The first cranial nerve is called the optic nerve. You're going to know this when you go to chapter 17, special senses. Oh, no. Chapter 14, I think, like the central nervous system. So the optic nerve, where do you see? Isn't it through here, right? Through your eyes. So you look at the orbit right in this, right? If you look at to the side, there's a perfect circular opening. perfect circular opening. Do you see that? Right? If you look at to the side of that eye, there's a perfect circle. You see the perfect circle?
Oh, I see.
Yep, that's the optic foramen. You see it right there. And you know what? Can you use this one and prove to yourself? They cross over the sella turcica. If you cross over the optic foramen here on both sides, right and left, you will see it will cross over the sella turcica, and that's why you're gonna have vision problems if you see how they cross over. They will X. See how they X over the sella turcica? Okay? They X over the sella turcica. That's why they have vision problems. You got that? Okay? So that's the optic foramen. The optic foramen is for passage of the optic nerve. So if we have a fracture that involves the optic foramen, you may be blind, right? May have problems affecting vision. Okay. Next. Oh, did I say optic nerve is cranial nerve 1? No. Why do I always mix that? Optic nerve is cranial nerve number 2. The first cranial nerve is the olfactory nerve for smell. This is the second part there. I mixed the two. I don't know why. Olfactory is for smelling. Okay? And so, now, where do you smell? What do you use for smelling? Your
nose.
Okay, so now we look at our nose. We imagine that we push this all the way to the top, and you see the foramen. Remember the olfactory foramen on each side of the cribriform plate. That's where the olfactory nerve passes through. Right here? Right here. You remember the cribriform plate of the ethmoid bone? You remember that? And on each side, there's openings. That's the olfactory foramen. Do you remember? You guys, do you remember?
So these nerves are way smaller.
Yeah, that one.
So these nerves are way smaller.
That's the olfactory foramen. Guys, this is the only foramen that the olfactory nerve is the only one. When we go to the special sense, that's actually the only one that has direct access to the brain. So that's why we want to be careful of those scented candles in it. That's why the scent, what you smell, doesn't affect your mood, right? It affects your mood. But also know that, the druggies, don't they? And they get a high, right? Because it goes straight. So it's not only the druggies. Please remember this, right? Whatever those, what you call it, your plugins or whatever, right? What are you smelling? You're actually smelling chemicals. And they linger in your brain. And sometimes they can cause Alzheimer's down the road. You never know what are in those chemicals and how long they linger in the brain. They may cause plaques that will lead to Alzheimer's, dementia, all kinds of problems. So just deal with the fart, right? Deal with the stinkiness. They will go away. The farting and the stinkiness, they're natural smells. The air freshener is artificial, synthetic. Those are chemicals. You never know what's in them. I love the NIH website. I just always look at latest studies on that one. Yes.
Are those the nerve openings that they use to do lobotomies when they did them?
For lobotomy, they go open the skull right here.
I thought
and
some
then
of them went in through either the nose or the eye.
No. They fracture a little bit of the skull, and then they take out a lobe. Yeah.
Oh.
Okay. So, but please remember that, right? If you have any air freshener, throw it. I don't know, for you, whatever you want. But to me,
Just
I
throw
don't
it away.
If your husband doesn't love you because you fart too much, then maybe it's time for you to have a talk with him, right?
Find a new husband.
A new husband time, yeah.
Okay, so we got that one right. The olfactory foramen is for olfactory nerve, right? So if there's a fracture there, you're gonna have smelling problems. The optic foramen is for the optic nerve. See?
That's neat.
Okay, now,
Yeah.
so we know the olfactory, we know the optic foramen, the perfect circle on the eye, right? Next to the perfect circle, you see another opening
Mm-hmm.
in the eye. It's a slit, right? Next to the perfect circle is a slit. That's called the superior orbital fissure. Next to the perfect circle is the superior orbital fissure. So here, through the superior orbital fissure, that's where cranial nerves 3, 4, and 6 plus 5. Cranial nerve 5 has 3 branches. So the superior orbit, so there's your perfect circle, the optic nerve, there's the nose, right? And then there's a fissure right here. The fissure goes on down here, right? The one on top is the superior orbital fissure. And cranial nerve number 3, 4, 5, and 6 pass through that. Cranial nerve 3, 4, and 6 are nerves that move your eyeball. They move your eyeball. They have nothing to do with vision. So I like a common question is, if you injure structures passing through the superior orbital fissure, you'll be blind. No, you will not. They move your eyeball. You know how you're able to go like the guys? They're with their girlfriends. There's somebody cute walking by and they go. Don't they do that? That's the nerves 3, 4, and 6. They're the ones that move your eyeball any way you want to go, up, down, whatever kind of movement. Okay? So we're going to know the names. 3 is oculomotor, 4 is trochlear, and 6 is your abducent nerve. But for now, you must know that those are the nerves that move your eyeball. Will you be blind?
No.
No. It's the optic nerve, right? Now, cranial nerve number 5 has 3 branches. There's 3 branches of this cranial nerve number 5, which is your trigeminal nerve. The first branch is called the ophthalmic branch. Ophthalmic branch, which is the one that joins them because it's in the eye. The ophthalmic branch of the trigeminal nerve joins this in the superior orbital fissure. Okay? The next branch is the maxillary branch. And then the third branch is called the mandibular branch. So these 2 other branches of the trigeminal nerve, they don't pass through the superior orbital fissure. Only this one. So 3, 4, the first branch of the trigeminal, plus 6. These are the nerves that pass through the superior orbital fissure. These 2 other branches of the trigeminal nerve pass through their own fissure. Okay? Okay. You must write in your notes that the trigeminal nerve is the nerve that detects pain, all kinds of sensation, pain, temperature, itch, pressure in your face. All kinds of sensations in your face is transmitted by the trigeminal nerve. The trigeminal nerve is also the one that moves your muscles of mastication. Do you know what mastication means?
Chewing.
Yep. So the trigeminal nerve moves your muscles of mastication, which means if the trigeminal nerve is damaged, you can chew. You can do elevate, depress your mandible, right? Isn't that part of chewing? Okay. So, we're done with looking at those openings there. Now we flip here.
What's the opening for the trigeminal?
The superior orbital fissure. Now we're going to go look at the next one right here. Okay, next. So there's your sphenoid, right? You see the upper wing and the lower wing? In the lower wing, okay? Try to trace the superior orbital fissure. Do you see the superior orbital fissure? Do you see it? Can you trace it now? Okay. From the superior orbital fissure, you go down. There's a circle opening there. Right next, right below the superior orbital fissure, that's your foramen rotundum. And then next to that is the ovale. And then next to that is the foramen lacerum, laceration.
So rotundum, ovale, and
So there's your superior orbital fissure, right? And there's a nice circle. That's the foramen rotundum.
ovale.
And then
Okay.
there's a nice oval opening, foramen ovale. And then there's an opening that looks like a laceration, foramen
Rotundum.
lacerum. If you know Russell
Ovale.
Wilson, R-O, rotundum, ovale, and lacerum. Russell. Because there's another pinpoint opening there, the spinosum.
So,
So it's actually like this, right? R-O, and then there's a little pinpoint opening here. R-O-S-L, Russell. Rotundum, ovale, spinosum, and lacerum.
Ours doesn't have a spin-off.
Here, I'll show you.
So it's a rotundum, ovale.
Rotundum, ovale, spinosum, lacerum, Russell.
lacerum.
Rotundum,
Okay.
ovale, spinosum, lacerum.
Okay.
Russell. Russell Wilson, right? Can you show, see it? This is your rotundum.
So
Rotundum.
rotundum,
And then there's your
ovale,
Ovale.
lacerum, and spinosum.
Lacerum.
Russell.
No,
There's your
spinosum, lacerum.
Okay,
Rotundum, ovale, lacerum, spinosum.
see it?
It's the lacerum, spinosum.
Mm-hmm. But you can see them different order. Like you can go rotundum, ovale,
Rotundum,
spinosum,
ovale, spinosum,
lacerum.
lacerum.
Just remember that they go right there and the spinosum runs away.
It's like a triangle with a little bit on the side. I'm gonna draw that.
So rotundum, ovale, lacerum, and spinosum.
Okay? Here. There's your oval. There's your pinpoint. Looks like a
You have to know these like
Okay?
that.
So,
Next lighthouse.
you see Russell Wilson? So the R, the foramen rotundum, is where the second branch, the maxillary branch of the trigeminal passes through. The foramen ovale is for the mandibular branch of the trigeminal nerve. The pinpoint, the spinosum, does not let any nerve pass. It's for the passage of a very important artery, the middle meningeal artery. Of the different openings that we're going to talk about, only the foramen spinosum is for the passage of blood vessel only. The middle meningeal artery that supplies blood to your brain, the meninges. Okay? Oh, no. Sorry. There's other openings. Sorry. The foramen lacerum. You see the laceration?
Yeah.
Is for the carotid artery, for the internal carotid artery. And then I forgot, there's also the vein, the jugular vein, or the jugular vein. So the lacerum is for the carotid artery. You know, you feel carotid pulse? So that internal carotid artery supplies your brain. So Russell, rotundum is for the maxillary branch. Ovale is for the mandibular branch. The spinosum, the pin, is for the middle meningeal artery, and the lacerum is for your carotid artery, the internal that goes to the brain.
What about the ophthalmic branch?
Huh?
The
What
ophthalmic-
did I say? Where does that go?
Well, the superior orbital?
Yeah.
Oh, okay.
Isn't that what I told you guys? Do you remember, guys? Did you write it down? Okay. So trigeminal has 3 branches, right? The first branch passes through what?
Superior orbital.
Second branch,
Rotundum foramen.
Rotundum,
and then the third branch.
Ovale.
ovale.
Yeah. And the trigeminal is important for sensations in the face and for mastication. Okay? So you're welcome to join the afternoon lab if you want, if you have time, or you can just, we're gonna continue next week. But if you have time, please come and join the afternoon lab. We're gonna continue with the bones. Okay? This one, it's either you do it very well or not, right? Pictures are pictures. It's still different when you look at it. So, did you notice? Some, even with the microscope, right? You still have to look at it. Just same with this one. Okay? Okay, see you later.
How do you spell that?